Hey everybody, I'm here with Tom, and Tom started chiropractic care about 3 weeks ago, and he was having some really severe pain in his leg and his knee after knee surgery a few months ago. And so I wanted him to tell you exactly what he's experiencing now, just 3 short weeks later. So tell everybody what you were having when you first came in.
Well, when I first came in, my knee was locking, and I was having a hard time straightening it out. It would lock for 10 minutes, 15 minutes. So I had to do something about trying to get my knee that went up locked. And I came here, and she's done just amazing work on my back to help my pelvis. I could feel my pelvis straightening out, to now I get up and I can actually start walking immediately without it locking. And that's just after 3 weeks. It's amazing. Yeah. Really amazing.
That's super cool. So also when he came in, because of how interesting or unique, I'll say, the knee problems were,
right,
I was telling him there was definitely an issue at the spinal level as well as some pelvic misalignment. So I knew we'd be able to make some progress there. But my suspicion was there was still something going on in the knee from the surgery.
Right.
And so, and I told him right up front, I said, we're going to get to a certain level, and if we get to a point where I think I need to send you back to get a reevaluation of the knee, we're going to do that too. So, the expectation wasn't, I'm going to fix this. It's, we're going to take this in steps to see exactly how far we can get it. But I'm even pleasantly surprised at how far it's come. So
yeah, it's amazing,
cool.
Really amazing to sleep without pain. If I do get pain, it's very little and it goes away quickly. So I'm very happy that I'm continuing this to make myself back to where I was before.
Yeah, and I wanted to point out something too on his knees. So this is the knee he had surgery on. This is the good knee. So when I did the knee evaluation, I took x-rays. The joint space in the knees looked beautiful. So I didn't see any arthritis in there, so that all looked great. But the problem is here on this knee this is his kneecap over here, and his kneecap actually should be here in the center of his knee. Now, his surgical knee, his kneecap is right here. So his good knee, even though he doesn't have pain, this is a recipe for, he was about to, this could go south pretty fast if we don't get the alignment good on here. So when he extends his knee, and I'll go ahead and extend your knee out, and now what's happening, and I wish I had had a video of this when he first came in, go ahead and bring your knee back down. So the knee's starting off at the side here, and now it's coming up and tracking into the center. There's a groove right here that the kneecap needs to travel across. But, okay, we gotta move the dog so you can extend
my baby.
Okay, so go ahead and extend your knee again. So now his kneecap is actually, even though it's still starting at the side, it's actually now tracking to the center of his knee, where before it was tracking straight up and down on the side. And that would be grinding along the 2 big bones, the tibia down here and the femur up here, and again, grinding down, and it could cause more arthritis later in life. So go ahead and drop your knee down. Now this knee cap is actually tracking quite nicely. So up and down on that. So it's just coming straight up and down there. So I gave him some exercises for both knees that would strengthen this middle part of the quadricep. It starts here and it goes up into the hip. And I gave him some stretches too. So we're going to show you on another video the stretches that I gave Tom. But the exercises I gave him, go ahead and bring your knee all the way up, or your leg all the way up. So we want to strengthen, this is called the vastus medialis obliquus. It's part of the quadricep. You don't have to remember that big name, but it engages in the last 10 degrees of extension. So go ahead and drop your knee slightly, and then now go back up. So if you have any kind of weakness in through that middle knee, or the knee doesn't track properly, you want to strengthen this by doing what are called these little short arc exercises. And when he gets to the top, he's supposed to squeeze that real hard and then release it and a little bit down 10 degrees and back up. So you're keeping that middle quad engaged and then really strengthening it. And so it's ultimately starting to pull his kneecap over.
And it works.
And it works. So yeah, he can feel that and he can see that too. So I just wanted to let you know that, chiropractic care, even though we're working on the spine, I'm also working on his knees. It's really about alignment. And once we get the body in the proper alignment, hey, anything can happen, right?
That's right.
So scale of 1 to 10, how happy are you here?
10.
He's a 10. Fabulous. And so we hope that this video is going to help other people who have knee issues, who maybe don't think that there's a spinal component, but aren't really getting the progress or the care that you want in order to go and live the life that you need, because he's on his feet all day long, right?
Yeah.
Yeah. So we got to keep this guy active and you know, not having to walk around in pain while he's doing it. So.
And since I've came here, my back is so straight now, and I'm just aware of my back. Because when I go grocery shopping, I lean on the cart.
He's a cart
and
leaner
then
guy.
I'm like, get off the cart. I mean, it's not what you want to do. You got to stand up straight. So you catch yourself, but it's amazing how straight my back is now and how good it feels. It's
nice.
just amazing.
Yeah, so if you're leaning on a shopping cart, call me, right?
Right.
Yeah, absolutely. All right, well, thanks so much for sharing your story. Appreciate it. And thank you guys, as always, for watching. Remember, please, if you like this video, share it with somebody you know that might be having some knee issues that we could help them with. And don't forget to hit that subscribe button. As always, I appreciate you being here, and I'll see you on the next one.
Thanks.